You hear a nurse talking to a patient called Mihira. Now read the question.
Mihira, your wound requires meticulous care. We're using a hydrocolloid dressing to optimize moisture balance and facilitate healing. It's crucial to change it every 3 days, or sooner if it becomes saturated. Gently cleanse the area with saline before applying a new dressing. Avoid hydrogen peroxide as it can harm new tissue. Monitor for signs of infection like increased redness, swelling, or pus. Mihira, if you notice any changes, contact us immediately. Regular protein intake is essential for tissue repair, so ensure your diet is balanced.
Now read the question.
A recent study investigated the efficacy of a novel drug, Zylodox, in managing chronic pain. Researchers conducted a randomized, double-blind, placebo-controlled trial involving 200 patients with chronic lower back pain. Participants were randomly assigned to receive either Zylodox or a placebo for 6 weeks. Pain intensity was assessed using a standardized pain scale at baseline, 2 weeks, and 6 weeks. Additionally, quality of life was evaluated using a validated questionnaire.
Now read the question. This is a scenario in one of the previous OT exam. Question: construct the sentence to include in the introduction paragraph. Case note. Name: Mihira. Age: 78. Diagnosis: terminally ill. Plan: hospice care. You talked to the nursing care manager about patient Mihira's hospice care over the telephone. Write a letter to Mr. Lehman-Jones, Nursing Care Manager, Royal Women Nursing Home, Maryville, West 3055, who will provide follow-up care in this case. Stress the importance of patients' wound monitoring, e.g., check for any infection, regular wound care, follow visit, etc. This is the end of the test. Now check the answers with explanation.
Answer: B. To create a moist environment conducive to healing. Rationale: the nurse explicitly states that the hydrocolloid dressing is used to optimize moisture balance, which is crucial for wound healing. Options A and C are incorrect as they contradict the nurse's explanation. Answer: C. Received an inactive substance resembling the drug. Rationale: the passage explicitly states that the study was placebo-controlled. A placebo is an inactive substance that is indistinguishable from the actual drug being tested. Therefore, option C is the correct answer. Some of the samples are as follows. 1. In reference to the previous telephone conversation about Mihira's hospice care. 2. Following the earlier discussion about Mihira's hospice care. 3. With respect to the previous telephone conversation regarding Mihira. These options provide clarity and variety while maintaining a formal tone. You can use any of these phrases as the beginning of your letter to establish the context for your subsequent points. Mihira, it's crucial that you monitor your wound closely. Look out for any signs of infection, like increased redness, swelling, warmth, or pus. Keep the area clean and dry according to the instructions given. Regular dressing changes are essential to prevent infection. It's important to attend your follow-up appointment so we can assess your wound's progress and provide any necessary adjustments to your care plan. Your active involvement in wound care is vital for a successful healing process.
Read the bonus question.
Syringe pumps, crucial in controlled drug delivery, enable precise administration of fluids over extended durations. Unlike traditional infusion pumps, they utilize a plunger mechanism, pushing medication at a programmable rate, ideal for small-volume infusions. Often used in intensive care settings, they manage potent drugs where minute deviations could have adverse effects. Advanced models incorporate pressure sensors and fail-safes to prevent occlusion, ensuring consistent flow. However, calibration errors or malfunctioning software can compromise efficacy, necessitating vigilant monitoring. Their utility is irreplaceable in scenarios requiring accuracy, especially in neonatology and anesthesiology, where patient sensitivity is paramount.
Now check the answer. Answer is B. The risks associated with malfunctioning systems. Rationale: the passage briefly discusses calibration errors and malfunctioning software as potential risks, emphasizing the importance of vigilant monitoring to prevent compromised efficacy. This implies that while syringe pumps are crucial for accuracy, there is an inherent risk of failure if the systems are not properly maintained or monitored. Other options mention important aspects, but the concern of malfunction stands out as a subtle but key focus.